Amani and I am a kinesiology human kinetics student. I chose the Lifelong Learning Center as my fieldwork placement. It's an educational community that allows seniors to register for courses that pique their personal interest, and courses available range from intellectual, creative, to physical in nature. I chose this agency after realizing it will allow me to work with fitness programming, chronic disease prevention and health promotion, Aboriginal grandmothers, emotion and mental well-being through support groups, and an overall focus on the senior demographic.
Amani has been working with us this term at the Lifelong Learning Center to do a number of things, including starting a Forever in Motion fitness group for older adults. And she's also working with us to identify fitness training needs for the staff who work at the Center for Continuing Education.
My special project started off as an idea to survey senior students at the center regarding which programs seem to get the most interest and what type of programming students would like to have available to them in the future. What didn't go as planned was that I was later asked to instead cater this survey to see what fitness programming we could possibly make available to staff at the College Avenue campus that is not yet available to them. So I adjusted my research, had discussions with staff members, and adjusted the format of the survey from paper to an online survey to be sent out to staff by email. Though it was no longer the focus of my survey, I was still able to use the information I received from discussions and participation with our senior students to help find new possible student programming for the future as well. Ultimately, the purpose of this project was to find out if staff would be interested in fitness and wellness programming and encouraging them to live healthier lifestyles. This also aligned perfectly with my learning objectives. So here was my plan. In January, do step 1, which was research on what courses are available in the community. In February, complete step 2, which is understanding my population and having discussions about their preferences. And then in March, doing step 3, which is creating the survey and sending it out using the Qualtrics program. And in April, doing step 4, analyzing the data to create a report for the agency to use for the future. I believe that my special project was successful regardless of the sudden change in direction. With the results of the staff survey, I was able to determine that the fitness programming at the workplace is desired. Because of my special project, there will be a creation of something new at the LLC that will help staff with busy lives still find an easy and convenient way to stay active. In terms of the value and effect on the agency, my supervisor can now take a next step to implement the courses based on the results of the staff survey. In my report, I also included the names of instructors for each highly selected course as well as a brief summary for the course to be advertised. What I learned that was unexpected in my survey results was that a lot of people that don't work out do want to become active. It just needs to be convenient. So the outcome of the survey shows that staff would love yoga, cardio, and Tai Chi classes available to them during lunch hours throughout the week. So this survey will impact staff by being able to figure out the best way to provide courses for them. The outcome of this project also served me well. Working on this project helped me develop skills like communication when speaking to different staff and students, as well as researching skills along with knowledge on how to use the surveying program. Also, I learned about perspective. Learning what others want meant understanding their point of view. This was an unexpected result of conducting a survey, but the skills will be valuable when understanding why a patient may not want to do certain exercises, for example, in my future health care related career. Though the project outcome is not what I initially expected it would be, considering it was not for students but staff instead, I still believe I received effective data that pointed towards starting fitness courses for a group that needed and wanted. If I were to do things differently next time, I would put my Forever in Motion training to use and demo fitness class for staff at lunch to have a similar experience before sending out the survey. All this being said, I believe that the most valuable aspect was simply connecting with populations that will be accessing the healthcare field more often, and finding a solution to help people stay healthy. I will apply this knowledge when having discussions on healthy living with these groups in the healthcare environment as well.